All right, well, good morning, everyone. We'll get started on time today. Thank you so much for coming to our special installment of our Osher Integrative Medicine Grand Rounds. My name is Aterah Nusrat. I'm the program manager for the Osher Center, and I have the distinct pleasure of introducing and moderating today's mini-forum on integrative medicine and climate change. And before I introduce our speakers, I have a few housekeeping announcements, and I'd like to give you some background and context to this special event. So in terms of housekeeping, if you haven't already signed the attendance sheet, please do so on your way out. And if you want CME credits, you can also make note of that there. The format of today's Grand Rounds will comprise 3 short talks by our presenters, followed by a panel discussion and audience Q&A. We are live streaming the event, and for the first time, our online viewers can also request a CME credit for viewing online. Hang on a second. There we go. So to do that, if you're viewing online, go to our website, oshercenter.org, go to our blog post for this event, and at the bottom of the screen, you'll see a registration form, and you'll need to complete that in order to be eligible for CME credits. And our online viewers can also submit questions if you go to slido.com and type in the event code GRJuly19. Okay. So moving on to this morning's presentations, I want to give you a little bit of background about how this evolved. So 2 years ago, at our annual Christmas dinner hosted by the Division of Preventive Medicine at Brigham, I learned that not only did our research director, Dr. Peter Wayne, share my interest in the impacts of climate change, but that during his doctoral and postdoctoral training in evolutionary biology, he studied the impact of climate change on both forest, carbon sequestration, and ragweed pollen production. You'll learn more about his journey and how his early ecological research has impacted his current research agenda in integrative medicine in his talk shortly. For my part, I came to the Osher Center with a professional and educational background in environmental sustainability and 20 years of meditation practice. So suffice to say, our respective and shared interests in both the environmental and healthy mind-body lifestyle arenas led to some interesting conversations between us, which turned into some practical questions as well. So I have those here. So we explored questions like this. What's the relationship between mindfulness and meditation and our individual and collective capacity to meet the challenges of climate change? Is there a role for integrative medicine to play at this intersection, given its emphasis on a healthy mind-body partnership? And what bodies of research and resources already exist in this regard? So these are the types of questions we're exploring, and we're very happy that we're hosting this first Grand Rounds to explore this. So I also want to acknowledge the backdrop to our event today. Both Harvard Medical School and Partners Healthcare continue their own institutional efforts. And you can see what George Daly says about this. They continue their own institutional efforts to reduce their impact on the environment. And in the Boston Globe last year, you may have seen that there was an article, an opinion piece called Climate Change Threatens Public Health and Doctors' Ability to Provide Care. This opinion piece was co-authored by Dr. George Daly, Dean of Harvard Medical School, Dr. Ashish Jha, Director of the Harvard Global Health Institute, and Dr. Aaron Bernstein, co-director of Harvard Center's Climate, Health, and the Global Environment. And this quote that you see here is from Dr. Daly, and this was in relationship to a joint commitment that Harvard-affiliated hospitals signed together, which represented more than 25 individual facilities, and their commitment was to reduce greenhouse gas emissions. So as you can see, the evidence is clear: burning less fossil fuel in power plants, cars, and buses translates into less air pollution. Less air pollution can help reduce risks for heart attacks, strokes, asthma attacks, and lung cancer, and improve pregnancy outcomes. So this sets the context for the talk today. And now I'd like to give you a brief introduction to our speakers, which we are very grateful for coming. Thank you so much. Our first speaker will be Dr. Renee Salas. Dr. Salas is an affiliated faculty and a Burke Fellow at the Harvard Global Health Institute. She is also in the Department of Emergency Medicine at Massachusetts General Hospital and Harvard Medical School. Dr. Salas served as the lead author on the 2018 Lancet Countdown on Health and Climate Change U.S. Brief, and she will again in 2019. She lectures on climate and health nationally and internationally, has published in high-impact journals, and is the founder and past chair of the Climate Change and Health Interest Group at the Society of Academic Emergency Medicine. And I'll just give you an introduction to Mr. Ravanesi and Dr. Peter Wayne as well. So Mr. Ravanesi has been with Healthcare Without Harm since 1997, working on public health, environmental, climate, and energy and resilience initiatives. He is the Senior Director of Healthcare Without Harm's Green Building and Energy Program and works on public policy at the state level on climate and energy. Mr. Ravanesi also co-coordinates the Boston Green Ribbon Commission's Healthcare Working Group and is co-director of the Massachusetts Healthcare Climate Alliance. And our final speaker will be Dr. Peter Wayne. Dr. Peter Wayne is an associate professor of medicine at Harvard Medical School and Brigham Women's Hospital. He's the director of research at the Osher Center for Integrative Medicine and currently the interim director. The primary focus of Dr. Wayne's research is evaluating how mind, body, and related complementary and integrative health practices clinically impact chronic health conditions and understanding the physiological and psychological mechanisms underlying observed therapeutic effects. He has served as a principal co-investigator and principal investigator on more than 25 NIH-funded studies. So that's an overview of our speakers. So with that, I would like to welcome Dr. Salas to the podium. Dr. Salas will be speaking on the key public health impacts of climate change and opportunities for Greater Boston.
So something led all of us into this room today. And for me, I discovered climate change and health about 6 years ago. And it truly resonated with every fiber in my body. And I knew that that's what I wanted to direct my career towards. And I feel very blessed because now working on this, it doesn't feel like work. And I hope that your work is similar. But I also hope that we can try to convince you by the end of this session to try to incorporate climate change into your work as a lens, whether that's adding an additional research question or including a line about it in your discussion, because climate change is truly that meta problem that connects to everything. And so why is it that I decided to engage on this and direct my career towards it? So one is that it's truly a public health emergency as declared by the Lancet. I think more importantly, it's our greatest opportunity. But I think this figure is really worth talking through, and it's something that really has resonated and driven me. And that's if you look at the map in the top left, you'll see that the size of the country is based on its contribution to greenhouse gas or carbon emissions. So you can easily find us sitting here in Boston. The map, though, below it is actually the size of the country is based on how the health burdens are going to be felt by that country. And as you'll see, we would really be challenged to try to discover where Boston is. And so I think there really is truly a moral and ethical imperative for us to act on this, because what we do here in Boston truly affects someone halfway around the globe. And I think the health perspective is truly what makes climate change personal. That is the great common denominator, right? We can't change time, and I mean, you could say money can affect health to some degree, but overall, everyone has health as something that they share with everyone else. So we're going to talk about the climate change and health impacts as well as the impacts on healthcare. But in addition, I really want to focus on the opportunities. So the Northeast is actually a canary in a coal mine, as outlined in the NCA report. And I would highly encourage all of you to read that chapter. So we know that Massachusetts temperatures have been increasing, but actually, we are going to reach 2 degrees Celsius, so we're currently about 1 degree Celsius. We're going to reach 2 degrees Celsius here in the Northeast about 20 years before the rest of the globe does. In addition, you can see that there's been increasing heat wave, so they've been more frequent and lasting longer. Any scientist in the room obviously would see there's a pretty clear trend here heading upward. In addition, billion-dollar weather and climate disasters have also been rising, and many of them have climate-sensitive components. The ocean is warming, and in fact, it's warming to a more dramatic degree. Here in the Northeast, in the Gulf of Maine, actually is in the 99th percentile for ocean warming globally. And sea level is also rising, and it's actually rising 3 to 4 times higher here in the Northeast. And as you can see, it's not evenly distributed along the coast of the continental U.S. So what does all of this mean for health? So I've sort of just did a whirlwind through the initial climate exposures that you'll see in the top of this diagram. But that also means that it has pretty widespread health impacts. And I always often say that our understanding of what the health impacts are is similar to an iceberg, in the sense that we see what's above the surface, and that's our current understanding. But I think there's a whole burden of disease that we have yet to characterize or understand. And so as you walk through here, you'll see that extreme heat waves we know cause significant morbidity and mortality. Air pollution, in fact, causes 7 million deaths predicted worldwide. Water contamination, so interestingly, the 8 pathogens that are actually cause the majority of waterborne diseases are climate sensitive. If you look, I'm going to talk about vector ecology next, but increasing allergens, which we actually have an expert here in the room. And so as increased CO2 in the environment causes increased pollen production, which has widespread effects. And climate change is actually impacting the nutrition, so the protein content in core crops, and actually decreasing mineral contents, which if you think about those populations in the world, they're on the nutritional fringe already. This could be enormously catastrophic. And then population displacement, which again, I'll sort of highlight some of that data in just a moment. So Lyme disease is something that we're all quite familiar with here, and something I commonly see in the emergency department. And as you can see, vector-borne diseases have actually tripled over the past 13 years, and Lyme disease, as you'll see, the incidence has also been increasing, especially in this area. I talked about the fact that oceans are warming, so Vibrio actually loves warm oceans. So the suitability for this bacteria is also increasing, which means that potentially more patients will become exposed to Vibrio, whether that be through direct contact in the water or through eating contaminated seafood. The Environmental Protection Agency actually created this map based off different climate drivers. So you'll see that RCP 8.5 is the more extreme climate exposure pathway versus 4.5. And you'll see they outline it between 2050 and 2090. And you'll outline here that red means people are leaving that area, and blue means people are then migrating to those regions. And you'll see the Northeast is predominantly blue. And that has implications not only for health, but also for the healthcare system. And it was an honor and privilege to be part of the Lancet countdown process, but this quote is actually what keeps me up at night. And there's pretty widespread effects, and I'm just going to hit a few of them. So this is a paper that was actually published by some of our colleagues here within the Harvard system around Hurricane Maria. And so it actually did door-to-door surveys of households, and it looked to see what percentage of households after this event were unable to get medicines, had roads that were damaged, unable to get to facilities because they were closed. And so this extreme weather, and something my research group is looking to further define, has pretty widespread impacts. Hurricane Michael, which struck Florida, I always like to use this as a tangible example. So the tweet on your left is actually a tweet that a hospital sent to the police after an event in order to tell them to ensure that a truck that had supplies would be allowed through a roadblock. So we know that communication obviously is disrupted, but I mean, this was very recent. And so we really need to think about how we can make our healthcare systems more resilient, which you'll hear about from my colleague. In addition, it can cause shortages of medication. So how many people experience a saline shortage? Raise hands if. So actually at MGH, we had a saline shortage in my emergency department. We actually stocked Gatorade in a cooler, like in a fridge, I should say. And so patients would come in and they would expect to get their IV and get their IV fluids for their gastroenteritis or, vomiting, diarrhea. And instead, I would give them under the tongue Zofran, and I would hand them a Gatorade. But it was also an enormous opportunity to educate patients about the globalization that we've been experiencing and the fact that there actually is a saline shortage because the majority of plants were in Puerto Rico and those were damaged, and we'd already had fluctuating shortages previously, and so that led to shortages here in Boston. This is actually some work the CNN did and showed where individuals migrated to following the event. So with all of that laid, we know that climate change is impacting health in a broad amount of ways, and in addition, impacting the healthcare system. But there is opportunity and hope, and again, I hope that you guys can try to find one way to try to engage on this issue. So when we talk about mitigation, what does that mean? So mitigation is really aimed at trying to decrease greenhouse gases, so decrease the driver of climate change. Adaptation means how can we try to protect health within this environment of climate change impacting health in the healthcare system, and especially for vulnerable populations. And then from a healthcare standpoint, how can we make our systems more resilient to the coming challenges that we face now and even further in the future? So when we talk about mitigation, you often hear about people talk about electricity and transportation options, and this is why, because that makes up more than half of the contributions within the United States to try to get to the root of this cause around fossil fuels and greenhouse gases. And so often clinicians are like, well, what does this mean for me? But I think one key thing is this figure, and this is who is the most trusted sources for information around climate change and health. And again, I said earlier that climate change is truly that component or that lens that makes climate change personal. So when we talk about mitigation action and trying to get especially federal action around this, who are individuals going to listen to? So television reporters are not really a trusted sources. You'll see the WHO, climate scientists, the CDC. In fact, and this is true even for skeptics, that the most trusted source for how climate change is impacting their health are their primary care physicians. So we have a powerful voice around this, and if we can amplify and unify the medical voice, declaring it the public health emergency that it is, that might then move towards some mitigation action. This is really the power of research. So how can we protect vulnerable populations? This is a study that was recently published this year. And just to sort of orient you, so this is looking at temperature, so it goes below 80 degrees Fahrenheit all the way up to 110. And you'll see that the red bar is where the bulk of hospitalizations occurring around heat-sensitive illnesses are occurring. And you'll see that there's quite geographic variation. So, in fact, the Northeast, as I've highlighted, and if you compare it to other areas, for example, the West, you'll see that the degree at which an individual suffers negative health impacts, and again, specifically vulnerable populations, is much lower in some regions of the U.S. And then the gray bar is actually where the heat alert actually goes out. So you'll see that the bulk in many different geographic regions, actually the bulk of the negative health impacts are occurring before the heat alert even is released. And this just really goes to show the power of research and trying to reframe how we can best protect populations. Now, for those of us in clinical medicine and academic medicine, this is kind of the classic triad, right? So just to highlight this, how can this actually impact our practice? Well, I would make an argument, and I always make it a personal challenge. No matter what someone does, I can find some way that climate change is impacting their clinical practice. So for me in the emergency department, we often see individuals who present during a heat wave. And I can tell them to follow up with their primary care physician, but to be honest, the heat wave might be over. And we currently do not actually ask, are they on medications that are predisposing them to heat stroke? Do they have an air conditioner? Even if they own an air conditioner, do they actually have the finances to run it? Do they have access to a cooling center? These are all questions that are very tangible and impact my daily practice. And again, I look forward to discussions on figuring out how it can impact yours. Education. We need to educate not only our trainees, but one another. Because no one's going to try to educate their patients around something that they have discomfort around. So these are an example of 2 curriculums that are online and free that you can use to educate yourself, and I hope that you can also recommend them to other individuals. Research is obviously key, and there are so many portals to try to intersect in how climate change is impacting health in the healthcare system. And as I hinted earlier, we have a lot of unanswered questions. And then, of course, there's personal choices. And you'll see the spectrum, everything from, eating a plant-based diet to driving an electric car. And I think these are important. But as a health professional, I truly think that amplifying and unifying that this is a public health emergency is probably one of the greatest ways we can have an impact. So as we continue with the discussion, I want to leave you with this. And that's with that we all have individuals in our lives, whether that are vulnerable, whether that be our elderly parents, whether that be our children, our friends' children, our grandchildren. And so put their pictures in this frame about why we should intersect with this and interact with this topic. And then try to, when you walk out of here, challenge you to try to find one way that you can try to incorporate this into your practice. So with that, I'm going to turn it over to my colleague, and I look forward to our discussion today. Thank you for the time.
So we had a reset back in October through the end of November of 2018 on the whole dialogue going on around climate crisis. The national, as Dr. Salas had said, the IPCC and the NCA, the National Climate Assessment Reports, came out. And basically the NCA said time is running out. And there were dire predictions coming from the IPCC. These are two really important seminal reports that I don't think a lot of the American public or world public has really gotten into the weeds on it, but it's coming, and we really need to prepare for it. Healthcare is in the front lines of climate change or climate crisis. So I took note last week, it sort of was unusual that there were 3 different media pieces that hit, one from the U.S. and 2 from the UK. The one from the U.S. essentially was a call to action calling climate crisis a health emergency for this country, and that more than 74 different organizations had signed on to it, acronyms that you're all familiar with, the AMA, ALA, American Heart Association, American Lung Association, the Healthcare Climate Council, which is 19 large healthcare systems across the country representing about 700-800 hospitals, which includes Partners Healthcare as part of the founding members of that, as well as Boston Medical Center, Kaiser Permanente, Dignity, Ascension, and the other big institutions that are there. They all signed into this. And it's essentially 10 recommendations as a policy roadmap going forward. And clearly one of the first of the 10 is we need to get off fossil fuels right now, today. And that's not easy because fossil fuels are everywhere in our lives. The second one was was reported in the Guardian newspaper on the 27th of June. And basically 1,000 physicians signed on and said that governments around the world have abrogated their responsibility on climate crisis. And they also implicated the media on poor reporting and educating the citizenry of the different countries. And then following that, by a day, was yet another one coming out of the UK that was from the UK Health Alliance on Climate Change. This represented all major bodies, health professionals and physicians in the United Kingdom. 650,000 health professionals and physicians signed on to this. This is fairly remarkable. I think what we're seeing at this particular moment is a shift that the healthcare systems throughout the world now get it and are moving forward in the front lines of climate crisis to do something about this very quickly, as fast as they can, to decarbonize their own footprint. So here, Renee had a similar image up here earlier. The larger the circles, of course, the greater the greenhouse gas emissions. And you can see that China is clearly the leader on the greenhouse gas emissions, and the U.S. is right up there close to them as well. If the U.S. healthcare system were a country and you were looking at greenhouse gases, the emissions of that, we would be the 13th largest in the world with emissions. Now, if you just looked at carbon dioxide, not all of the greenhouse gases, as we saw in that last slide where it sliced and diced the different methanes and other nitrous oxides and sulfur pollutants, you would be the 7th largest emitter of CO2 in the world. So the footprint of healthcare is really colossal, and that we have a moral obligation to get a hold of this and move forward. I'm going to be showing you some data in a minute from 2003 to 2013 where, let's see if we can just jump to that for a second. where healthcare's footprint, carbon footprint, increased in that decade by 28%. At the same time, all the other sectors had reduced by 6%. That's pretty astounding. However, that's the bad news. The good news is that healthcare pivoted very quickly. And what we've seen in the last 7 years, or 5 to 7 years, is early adopters in healthcare in this country, the Kaisers, the Partners, the Dignities, they have really stepped up. The Healthcare Climate Council, which is a big national group of these 19 systems that I mentioned earlier, they are doing incredible work of reducing their greenhouse gases. And in Massachusetts, we have a state mandate to reduce our greenhouse gases by the year 2020 by 25%, and at least 80% by 2050. Now, that's for all sectors. So the healthcare sector in Greater Boston, Metro Boston, has been working on this for the last 8 or 9 years to reduce their own footprint. And what's come out of that is, let me just power forward here. Where is it? Oops. Let me just run up. Woo. Getting lost here. Here we go. You can see the straight line up top. That's the energy efficiency work from 2011 through 2015. And all of a sudden, watch these lines get projected forward as to what's happening here. This is renewable energy purchasing that's happening right now, right here at Boston hospitals and at other hospitals across the state. We have met the state mandate of 25% reduction 3 years early and 7 percentage points better. Now, if you compare us to the other sectors, commercial real estate, higher ed, hospitality, cultural, all the cultural institutions across the state, the healthcare sector has zoomed ahead of everybody. So you can see that data from 2003 to 2013, we were really going in the opposite direction. And now you can see here, let me just go back. If you take a look at the graph on the left side here, the dotted blue line coming down is the Paris Treaty agreements that we're adhered to, still adhered to, and hopefully will continue to be. And then you can see the actual GHG emissions, the solid line going up here, and then the red line is the actual and projected health expenditures there. And on the right side, if we did business as usual, if these hospitals in Massachusetts and other places around the country had not done what they've been doing for the last 5 or 7 years with mitigation, resiliency, energy efficiency, etc., these two lines on the right-hand side, we would be tripling our carbon footprint by sometime between 2040 and 2050. So you can see there's no way we cannot pay attention to this. We need all in. When I talked at the opening about those press pieces that came out with these physicians and health professionals signing on, that's a wave happening right now. And so part of why I'm here today is to implore you to please talk to your colleagues about this. Talk to your family, your neighbors about this. Time is running out. And what is coming at us is completely going to change the face of our experiences for our children and grandchildren. And if I were in politics today and had any sort of a say, what I would like to see as a cabinet position in the United States is a secretary of the future. Secretary of the future who would look out for the health of the children, the grandchildren, and the great-grandchildren, because that's not happening now. And we can see with the Juliana case that's in the Supreme Court today, the children are rising up. They're boycotting schools on Fridays across the country, and not only in England and in this country, but in other places around the world as well. The children are now speaking up because they think the adults have really, excuse my language, have left them behind. So that's the pitch today, is to get you involved. So here's a closer look at your sort of environment that you have. The larger, these clouds that you see here, these are the areas of interest where we see greenhouse gases. And the larger the cloud is, the greater the emissions on greenhouse gases. So you can see energy for heating, cooling, and lighting, and water use. Waste hauling, supplies and materials. Just think about all of the materials coming in and out of the hospital, the supply chain of that. And Dr. Salas talked about the IV bags that were made or are made in Puerto Rico and what happened there. Just think about all those trucks that are coming and getting on boats and moving around the globe. The supply chain is a global supply chain. Meat procurement. Meat is responsible globally for 14.5% of greenhouse gases. Well, what's an easy thing a hospital can do? How about meatless Mondays and meatless Fridays? Let's serve less meat, and that'll help to reduce. And then, of course, there's vehicle miles traveled. Now, there's a health system, I won't mention the name of it, but they have fleets, and they have tens of thousands of employees, and we have vehicle miles traveled. If you don't count the vehicle miles traveled for this health system, which is a lot of miles, just don't even count that, they still do another 1 million miles. So these are big numbers that we're talking about. And we have a transportation system, as we all know, that's broken. A few people came in late today. I'm sure it's because of the congestion that we have. So now I just want to move into a couple of things here of what's really going on with Partners Healthcare. This is a piece that I'd like to talk about because they are such a national leader on decarbonizing the work that they have done. John Meservey, the corporate director of design and construction at Partners, and his team, and the hospital staff, the engineers. This is a big group of individuals that are pounding away on this. They started out with energy efficiency at the turn of the century in the year 2000. They've been doing energy efficiency ever since. Mass General has saved 75% on energy efficiency initiatives that they have put in place. $108 million was saved over a period of several years just on the energy efficiency piece and the incentives that come in from the utilities. So Partners put their heads to this back in 2014 to do a vulnerability and resilience study. We'll get into that study in a moment. But they looked at the key factors here were sea level rise and storm surge. Well, let's look at the Mass General campus. The Charles River is there, the confluence of the Charles along with Boston Harbor, and the area is all filled land. This is a big issue coming at us with sea level rise, storm surge, and increased precipitation. So sea level rise, more precipitation, high winds, increasing temperatures, more frequent power outages. They've reduced their carbon footprint. They started a strategic energy master plan back in 2008, and that was a 10-year plan. They have stuck to it year by year, initiative by initiative, and they have driven down their carbon footprint. So let's take a look at the feasibility study. And I want to give a shout out to Aterah, which is a consulting firm, a global consulting firm that's working with Harvard on this vulnerability study right now. Phase 1 was completed in the summer of 2016. Phase 2 was completed in, I believe, the autumn of 2017. And Phase 3 right now they're wrapping it up, I believe. And David Lorimore's in the audience here. David, am I right on this? When is the Phase 3 going to be ready for public look?
Phase 3 should be finishing in about 5 to 3 months.
Well, that's just fabulous. Great. So this is something that you don't see other institutions doing. When Partners did the Strategic Energy Master Plan, Healthcare Without Harm approached Partners and said, listen, a lot of the hospitals, their margins are less than 0.5%. They don't have money to go hire an Arab or somebody else. So could we take the results of your Strategic Energy Master Plan, like where is the fruit on the ground and the low-hanging fruit, and can we take that information, put it up on our website and the Boston Green Ribbons Commission's website, and attract other hospitals to come here and look at that. And partners said, no problem, let's do it. A sharing process, which was the first time we've seen this with some data going out, that recognizing that we have to all be in on this. This is something where all boats are going to have to rise together to get to where we need to be. So the study itself, the outcome of the study will enable partners to determine the risk vulnerabilities, the level of resilience, and ways to mitigate those vulnerabilities. So I think we can get into discussion. I think I'm out of time right now, so I want to thank you for your attention.
So I want to begin by thanking Ms. Nusrat Aterah for inspiring and coordinating this event, and also to thank Dr. Salas and Mr. Ravanesi for their participation in giving such informative and inspiring talks. I'm going to shift gears a little bit today, and I want to ask the question, or explore the question, can integrative medicine serve as a prescription for both patients and the global environment? So as Aterah mentioned earlier, my scientific career began in the field of evolutionary biology, and for 15 years my research focused on how different temperate forest species evolved unique strategies for sequestering carbon, and in turn how these forests might respond to and influence rising CO2 levels. Towards the end of my work in this area, I also began to explore how climate change might influence pesky species. And Dr. Salas mentioned ragweed, and what we found were things like anticipated levels of CO2 and nitrogen deposition would greatly increase the pollen burden in areas such as New England. Meanwhile, I've been practicing Tai Chi and other integrative therapies for many years, and with support from my family and mentors, I made a quite significant leap to studying mind-body and integrative therapies, which I'll argue in a few minutes I believe is still an ecological endeavor. However, thinking about this connection between integrative medicine and climate is really new for me. This is the first time I've ever put some of these thoughts together, so I apologize in advance if all the ideas don't fit together quite well, and I know in this very limited amount of time I can't capture everything, so I hope in our discussion we can pick up on some of the things that I've left out. So what I'm going to try to do in the next 10 minutes or so is begin by briefly defining integrative medicine, because this is a diverse community, using an ecological or a systems biology framework that is implicit in our Osher Center. Then I'll give some examples of how preventive medicine may be able to reduce the footprint that Mr. Ravanesi and Renee have talked about. And then I'll share some examples of how tools that we use in integrative medicine, especially behavior change tools, show promise in moving us towards what's called a lower carbon happiness footprint. It may even make us kinder to one another, and therefore that might translate into the future generations that both the speakers spoke about, and to the environment directly. And finally, I'll conclude picking up where Dr. Salas did on the implications of these ideas for integrative medicine clinicians and their patients with respect to addressing climate change. So I think everyone here is really familiar with our current medical system, which is only about this organ-based system, this reductionist approach, is about just over 100 years old. And I think we all appreciate the value of this. If we have a heart disease, or we need a kidney transplant, or we have to see an oncologist, we want to go to experts that really know their field in great detail. People who spend all their time focusing in one area. But I think we all appreciate that there's side effects to this specialization or this fragmentation of both the body and of the healthcare system. And to use an ecological metaphor, sometimes we miss the forest for the trees. And what we think of as integrative medicine at the Osher Center is not just putting an acupuncturist in a pain clinic or a mind-body specialist in a depression clinic, but seeing the health of the body and the whole person by interconnecting these systems, by looking at their integration of the mind and the body, of exercise and mental health together, and also how those systems within the body interact with the environment. And that's illustrated nicely to the right here, this is a diagram from a book on Chinese medicine, but I think it applies to medicine as a whole, that in this more holistic or integrative approach, the body is viewed as this interdependent system, and there's synergy. When everything's working together, the whole is greater than the sum of the parts. But that interaction also includes the environment. And the role of the provider in that context is more of an ecologist or a gardener, and they're there to help the patient and work collaboratively to enhance resilience and self-regulatory capacity. And there's a strong emphasis on prevention. And I think this prevention piece will come in a lot if we can work upstream to reduce the burden on the healthcare system. And then on the left, you see an extreme polemic here. It's, more of a reductionist replace the part system. And of course, it's never either or, and both systems have great value. So just talking about prevention, I think it was Benjamin Franklin said that an ounce of prevention is worth a pound of cure. Those of you who were here last month at our grand rounds got to hear a really fantastic lecture by Samia Mora on the Mediterranean diet. And so I won't go into much detail about this, but basically this is a really profound study, large sample size in people with high cardiovascular disease risk factors. And what it showed is that simply putting people on more of a Mediterranean diet, either supplemented with olive oils or with nuts, compared to a lower fat diet, reduced the incidence of cardiovascular events and disease by 30%. That's a huge impact if you translate that to carbon and all the buses moving around the hospitals and all the things that Mr. Ravanesi has talked about. Okay? There's not a lot of time to talk about this, but another important Lancet commission, complementing the work that Dr. Salas has done, came out this a few months ago by Professor Walt Willett here. Many of you know him at the Harvard School of Public Health, and a huge panel of colleagues from around the world. And basically their conclusion is that eating well is good for the patient, but as well for the environment in terms of sustainability and its ecological impact. And I think Dr. Ravanesi has spoken to that as well. So these upstream effects, I think, are really relevant and within the scope of general medicine, climate issues, and as well as integrative medicine. Another example of prevention upstream is closer to the work that I do in my lab, and also working with Dr. Gloria Ye here, our Associate Research Director, is preventing falls in older people. Our population is growing exponentially, baby boomers, and falls are a huge issue in this population. And about 1 of 3 older adults over the age of 65 fall every year. Many of them have serious injuries. And the burden to hospitals, to their families, of course, but also the societal burden and costs is in the billions and billions of dollars a year. And so are there things upstream we can do? And not surprisingly, there are. And one of the best tools out there, according to Cochrane and many other research, is Tai Chi. This is the results of a study done by Fuzhong Li, who's out in Oregon. And basically, what they found was that a 6-month course of Tai Chi training can reduce injurious falls by 50% and serious injurious falls by up to 75%. And there's a lot of other research. But these are just examples of what we can do upstream to reduce the burden on the healthcare system. This is a really interesting study at the interface of sort of modeling how health behavior change and environmental change belong in the same model. This is some work done at the University of Wisconsin. And let me tell you a little bit about the logic to it, and I think it connects some of the work that we've heard around. So we know that automobile traffic results in lots of pollution. Particulate matter here is what's emphasized, and ozone, and that leads to poor health, and especially short trips. Short trips where your car is not warmed up tends to release disproportionately higher amounts of pollution. We also know that not driving when you can, and I really tried to ride my bike this morning and it just didn't work out, but I rode it yesterday to my hospital meetings. But short trips on your bike can improve health and fitness. And so this group modeled what would happen if just half of your short car rides were converted to short bike rides instead. And it used a catch basin of 11 metropolitan areas around the Midwest that included about 31 million people. And so this model basically found that, of course, not surprisingly, using really good data on pollutants, that converting half of these trips reduce particulate matter and regional ozone significantly, and the health benefits associated with that reduction in air pollution, for the reasons that we've heard, were about $4.5 billion per year just for that region. There were an additional $3.8 billion benefits to increasing physical activity and health of these people, and the combined effects of just this modest one thing you can do initiative was about $8 billion per year. Right? So there is a place to combine these issues, and these are the sorts of things that Dr. Salas was saying. Maybe this can be part of your conversation. But we have to keep people healthy to be able to ride their bikes and walk and do these things. This is a study that we did at our clinic, and our clinical director, Dr. Levy, led this team. But it's a very simple study asking whether taking people through an integrative medicine clinic that includes chiropractic, acupuncture, yoga, tai chi, massage, can do better than usual care. And we were matching people to other people in our hospital system. And this is for chronic lower back pain. And what we can see here is over the year of time, we improved disability-associated back pain. And these questionnaires typically say, can you still play with your grandchildren? Can you carry groceries? So this is keeping people functional, keeping them moving in the real world, primary, in this case, secondary prevention. And this also, we've seen this in other populations. This is some work that Gloria led in cardiovascular disease. These are heart failure patients. Some of them were quite advanced. And these patients are very fearful of doing exercise. They're deconditioned and they're afraid it's going to exacerbate their conditions. Not only did we improve cardiovascular outcomes in terms of their ability to walk a certain distance and emotion and things like that, but it changes their self-efficacy, their confidence in doing exercise. And this is actually a quote from one of our patients that I think links back to the previous study. They said, I do more now. I'm riding the bike on a daily basis. I start off by doing a little bit of Tai Chi, loosening up my body, and then I get on my bike. So we're starting to think of Tai Chi as a way to bring people back into the exercise ecosystem. It's like a gateway exercise for people who are afraid of moving because of pain or being deconditioned. So self-regulation. I know for myself and many of us, if we don't feel very good, we don't necessarily use our best behaviors. We might choose to buy things or eat things. It's like that Snickers commercial, when people are really grouchy and not in their best mood. It's like, have a Snickers and shift your mood. Is there a way that these practices can help us make better choices? One of the areas, having grown up in Brooklyn, where I saw a lot of this sort of maybe not so healthy behavior, and this is a typical bumper sticker, is when the going gets tougher, there's a lot of stress, the tough go shopping. There's this sort of shopping behavior. And we know that shopping, as an example of excess behavior, is not only due to necessity, but boredom, addiction. Some people use it as therapy. And the carbon footprint of shopping is actually quite high for all the reasons of transportation and packaging and those sorts of things. So are there ways of satisfying those feelings in more carbon healthy kind of ways? There isn't good data yet on studies to change shopping compulsion, but there are around other addictive behaviors. And the premise here is that we take a breath, we slow down, and then there's a gap between the feeling and the impulse. We have some room to make better choices. This is some work done by Sarah Bowen, who's out in Oregon, just some really nice work in mindfulness area. And this is looking at substance abuse and drinking addictions, and they added a little bit of these mindfulness practices from integrative medicine into a traditional relapse program, and they found that after 12 months there was lower relapse and also both at 6 and 12 months, fewer days of substance use and heavy drinking. So there's a way that these therapies may help us make the shift to healthier behaviors, which is all really hard, as we all appreciate. There's also some evidence out there that it might make us kinder people, and kinder people that are more considerate of one another, more considerate of our grandchildren and our grandchildren's children, and maybe even the environment. This is a systematic review done by one of our fellows, Tina Luberto, and Gloria was part of this. And I want to just say, for a lot of this work, I'm just exploring the possibilities. The data here is pretty thin in many cases, but this systematic review suggested that there was some promise in enhancing pro-social behavior. And I'll show you one example. It's one of my favorites. This is done here in the Boston area. Gail DeBoard is over at Mass General Hospital. And basically she taught people 2 types of meditation, and she was asking, will this make them kinder? So typical mindfulness meditation and also compassion-based meditation. And I love her outcomes. They're very visual and practical. So people came in for their follow-up visit after 12 weeks of this training, and they sat in. So this is the person who just came in for their appointment for follow-up. And then someone who was scripted to be in there, but they didn't know, came in with a disability. And the question was, how long would it take for them to give up their seat? Are they more kind? And the short answer was that they did, that both meditations, both mindfulness and compassion meditation, enhanced the response time, basically offering a seat to someone who's suffering. Both were better than weightless control. So there's some data out there that suggests that these behaviors are plastic. And so the question would be, would this extend out to non-human species into the environment? And I had the fortune as a graduate student in evolutionary biology to be a teaching fellow for Professor E.O. Wilson, who's one of the most outspoken person in taking care of the environment and one of the most compassionate people I've ever met. And his book, Biophilia, creates an evolutionary framework for appreciating how the altruism we've developed for one another as a social species might bleed out into care for the environment and other species. So I think there's some frameworks that we can use there. This is just one small study done by Adam Hanley. He's out in Utah. And basically, it's a cross-sectional study showing that this construct of mindfulness that we know is plastic and more pro-social behavior is correlated with pro-environmental behavior and a sense of being connected to nature. And my very last piece, I want to set some context up for this before I show it, is a study done by Yang, that's his name. He was doing his PhD out in Champaign-Urbana, Illinois, University of Illinois. And I want to tell you this population because I got to visit him during this study. This is about, I think the average age was about 80 plus or minus a few years. And these were Midwestern, largely women who go to church every Sunday. These are largely Christian populations. So these aren't mind, body, woo-woo sort of people who are already, involved in non-traditional spiritual traditions. And I want to read one of the quotes about this idea of how these practices might make them more porous and feel connected and part of the environment. So this one woman wrote, Tai Chi gives a way to create a spiritual moment that it's also very helpful. I'm more aware of my spirituality. I would have never thought, when you're doing our meditation and you look out there and see the beautiful trees, that's God's energy. It's going to be part of me. It's like when we're doing this exercise, and very typical exercise is gathering the energy from nature and washing it through you. Like when you do that washing your organs and gather nature energy with our hands, that's God's energy washing through me. It's something that offers an opportunity for connecting myself to a spirit within that's part of a larger whole. So I think these practices dissolve that sense of self and other, self and environment, and may make us a bit more open to the imperative of feeling connected, not just for us, doing well for ourselves, but for others, for future generations, and for the environment. So to summarize, I think integrative medicine can be a prescription for both patients and the global environment. The data I've presented for prevention, I think there's a lot of good data out there. Some of the other areas, I think there's a lot of room for additional research. Obvious places of overlap includes integrative medicine's emphasis on prevention of healthy behavior, prevention on healthy behaviors that lead to sustainable and lower carbon happiness or wellness, and on mind-body practices that enhance self-regulation and pro-social and pro-environmental behaviors. And so when I grew up and I was particularly getting interested in environmental issues, the slogan at the time was think globally and act locally. And I think that's really important. I think all of these movements, getting involved in educating your patients is important, being involved in other areas are ways to make a difference. But I'd like to extend that and modify it and say that maybe we should think globally and act extremely locally as well, which means contemplate our navel. So thanks for listening.
Thank you, Peter. In the interest of time, if we could have our panelists please come to the front. Yeah, so aware that we're about almost to time, but just to give you an opportunity to ask some questions, we'll run over a little bit, so I hope that's okay with everybody. So if anybody has any questions, we'll move straight to the audience.
I was taking pictures of slides, but I'd much rather have a paper or a document that I could give you credit, and which I would anyway. But are there? I want to learn more. I want to be able to use this material when I'm talking to the folks that I work with.
Can I just respond? This has actually been video recorded, so it will be archived on our website. So all the materials on this particular presentation you'll be able to watch again.
Hi. We are in a rather divided country. If you haven't noticed, it's hard to be in the middle on any political issue. If all the candidates running for president were to come through, is there one question we should ask all of them about the environment or about climate change that would help us decide whether they're really someone we should vote for?
Can you hear me? Yeah. I think in the first or the second debate, there was a total of about, 5 or 7 minutes on climate. In the last election cycle, there was 0. We have a long, long way to go. And so asking a question, clearly we need to get off of fossil fuel. I think that's the big one with decarbonization, and we need a commitment with a time frame on this coming from candidates, and then rate the candidates on who has the in the weeds on the climate crisis and dealing with the climate and health issue in particular. The IPCC report, talked about mass migrations coming, food shortages before 2040. I mean, it's really a dismal picture, and to read it, it's a shocker. And I'm in this business, and I was shocked by what I read, especially geared to the time frame that we have. So I think you're right. We need to get these politicians and new politicians to really start committing to this with some real value behind what they're saying.
It's a great question. I think I would ask them why we should act on climate change, and as far as to understand if they really see what the broad impacts are, and the fact that, again, I think the health lens is truly the one that can mobilize action. And I think that we as a climate change community haven't done a good job of making it personal for people. It's always been polar bears up on icebergs, and it hasn't actually been our children or our grandchildren or ourselves. And I think, again, health is the one lens that makes it personal. And I also would see, by asking why, if they really understand the critical urgency that exists. I mean, we all live at a point in history where we have a profound responsibility, but I also think opportunity, where what we do now or don't do is truly going to determine the health of nations for centuries to come. And I think that urgency, which, as it's been highlighted hopefully through the talk today, is critically important. So those are the two things I'd ask. Thank you.
On the question of air conditioning, although that is a big problem, it's also, in many cases, a health necessity, and for some people, just comfort. Is there anything in the horizon that we can have air conditioning without creating all the problems that it creates?
I'm not an expert on this, but I do know that technology is not always our enemy. I think that there's solutions there, and there's efficiencies that can happen. I remember doing this modeling exercise with my son. We were driving, and the question was, do we put the air conditioning in the car on? And it's never a black and white sort of issue. If your window's open, you're driving fast, your fuel efficiency goes down. So there are these ways where I think a lot of thoughtful work needs to happen. I think the groups that Mr. Ravanesi here is part of bring all of these different perspectives together. I think we need to think very carefully about those things. But it's very rarely a black and white either or kind of issue.
I would just add one thing, and that's that there was a recent report that BP Oil, of all entities to put out, actually showed that the carbon emissions from the energy sector have been increasing because of these extreme weather events. And obviously one of the things driving that is these extreme temperatures are driving the use of energy grids. But if our energy grids are actually sourced from renewable energy sources, then we can kind of eliminate that contribution. So just another reason to try to switch over to 100% renewable energy.
Just a point of to follow up for 1 second on air conditioning. It's so easy to modulate it. Like my air conditioning is set for 78, and I wear just sleeveless shells around the house. And I notice that the 3 people in the front row are wearing jackets, and my feet are freezing in sandals. So there's a lot of room to improve just today by what we do, degree by degree by degree. So anyway, my question refers to the hospitals and what the hospitals are doing, and I'm glad that you brought it out, Mr. Ravanesi. I look at all the single-use plastic, and they be turned into reusables, washables, or compostables, and all the excess packaging, just to let hospitals look at themselves and clean up our own houses, and it would. And the idea of serving less meat is certainly a big one. Yeah, but there's others.
Healthcare Without Harm, over the last almost 24 years, we've had a number of different initiatives. And if we go back to the turn of the century, we were really focusing on some of the things you've just mentioned. How do we reduce, first off, the plastics? How do we reduce the disposables? And we took those into different departments of hospitals throughout the greater Boston area and then across the country and then globally. Healthcare Without Harm at this point is a global organization. We have a membership organization called Practice Green Health that has 1,100 hospitals that are our members. We service those hospitals on a whole host of sustainability issues, including the plastic issues. We had a campaign years ago on getting rid of polyvinyl chloride. Plastic, well, the Darth Vader of all the plastics. When that gets burned, it creates dioxin. The dioxin gets into the atmosphere and it falls down onto cows and hay, gets into the milk, gets into the beef, and dioxin is probably one of the most potent carcinogens that we know of. So moving these pieces in and out of the supply chain is very important. It's very difficult. Let me give you an example. We had a campaign on IV bags. There are a great number of them at the turn of the century were polyvinyl chloride, and they contained a diethylhexyl phthalate, a phthalate that is both a reproductive and a developmental toxicant. We tried to pull that out of hospitals across this country, and in fact, we centered on the NICUs first and maternal departments first, and we were able to pull it out. And after a couple of years on that campaign, I moved on to other issues. And what happened? Abbott and Baxter came back in with the big semi-trucks full up with free IV bags that were made of polyvinyl chloride, changed the contracts around overnight. So you need constant vigilance to do this. It isn't you can just pull something out and it's gone forever. It isn't. Capitalism has a way of, these bags cost pennies by comparison to a cleaner bag that's made of polyethylene, polypropylene bags. So it's very difficult. The supply chain is very complex. The group purchasing organizations are multi-billion-dollar companies, and they have one thing on their mind, and that's profit.
By the way, I just came back from college reunion, attended a panel run by the Atkinson Center there at Cornell, and I wound up in a discussion with Natalie Mahowald, who's one of the signers of the IPCC agreement, about, she said, you don't have to worry about cow farts. And when I challenged her on this, she said, and this is something that is not general knowledge, is that methane stays in the atmosphere for 10 years. Carbon dioxide stays in the atmosphere for hundreds of years. So, and that sort of thing is not taken into account when you come up with these 17% is due to cows. A lot of that is not calculated correctly.
Okay, we'll take a question from the online audience as well, if that's okay. And then we'll wrap up shortly after this. So, Peter, I think this is a question for you. I mean, you've already alluded to it, but can you give any practical examples for how to reconnect ourselves with the environment? This person tries to be mindful of not to buy water in plastic bottles, etc. One other example you could give.
Well, this is good because I didn't get a chance to describe one study, but I think research is really important. We need to approach this and learn as many different ways. But there's a fantastic study that's being launched at the University of Wisconsin by Bruce Barrett, and it's a randomized trial. And what it takes is these mindfulness programs, which we've seen, have some modest behavior change effects, and combines it with climate education. So you've got this combined program. And what I love about it is the unit of study is the household. So they're taking middle to upper class people in the Wisconsin area that own a home and at least one car. And the outcomes in this randomized trial, you get I forget what the comparison group is, but there's an active comparison group versus this mindfulness plus education. And the outcomes are, let's look at your electric bills, let's look at your water bills, let's look at your mileage, let's look at your biking and physical activities. So they're really trying to change self-awareness, self-education, but seeing if that really makes a difference literally where the rubber hits the road. So I think this kind of work, if we can find programs like this, can be sort of a bottom-up approach to changing things while all these other policy things go on.
Dr. Salas, Mr. Ravanesi, would you like to make any closing comments?
I would just say that we can all make a difference, and I think that eco-anxiety is a real phenomenon, and I think that it's something that I know those of us who engage in this, talk about and support one another, but I also think that it can impair people from action, and I think recognizing the hope and opportunity, and that especially in the unique power of the health voice, that is really our ability to really move the needle on this, and I think we have a profound responsibility and ability to do it in a way that very few sectors can. And so I look forward to doing that together as a community. Thank you.
I think to get where we need to go, and if you're looking at this in a smaller scale like the state of Massachusetts, we really need to get more voices on Beacon Hill on policy advocacy. As an example, in the last round, both the TUE committee, that's one of the energy committees, and the Global Warming Committee, they have a series of hearings, and one of the things we're trying to do is to increase the amount of renewable energy on the grid. Now, the utilities really don't want to move in that direction very fast. They'll do what they have to do at the minimal amount. So we have, right now, every year it increases up to last year by 1%. The utilities have to buy 1% more of renewable energy to put on the grid. Well, that's nowhere really for where we need to be right now. So there were several bills that went in, and we were able to activate the healthcare sector to get physicians to come and testify. We got the CEO of Partners Healthcare, Dr. Dave Torchiana, and Dr. Kate Walsh, the CEO of Boston Medical Center, to write an op-ed in the Globe to say we need to triple it, at least triple it. And the fight went on. And it's a 2-year legislative session here, and it took 2 years. And at the end of it, we got it doubled. We couldn't get it tripled. And so we can go back at the apple and take another bite at it in this session right now. And so what was of interest to the senators and the reps, they had not seen physicians or C-suite executives come into these hearings representing the healthcare sector, which has a fair amount of standing, and they took it to heart. I think without that, we would have ended up with the 12 lawyer suits that come in from the utilities basically saying, no, we can't do that. It's too onerous for us to do that. We're not going to do that. But that was counted by the healthcare voice. So we actually got that through in the last session. We have a number of other pieces right now. We have a 100% renewable energy piece right now that's being debated on the State House. We have on July 11th, we have a Lawmaker Education Day. We will go up there. Healthcare Without Harm and Ceres and Environmental League of Massachusetts are coming together, 3 nonprofits, with about 40 other individuals from the public. So there'll be medicine men there. There'll be businessmen there. Ceres is bringing Fortune 500 companies to the table as well. So we're going to have a strong voice, but we need more of that to sort of change the sense of urgency that we need to move forward here.
Wonderful. Thank you, Mr. Ravanesi. Please join me in thanking our speakers today.
And I want to thank Aterah for inspiring and bringing us all together, and thank our speakers personally, and to say how happy I am that it's another dimension of integrative medicine that the Osher Center can play a role in. So thank you all for coming. And there's some information out there about our next grand rounds, which goes back to nutrition and some of these other general issues that we talked about today.
Great, wonderful. Thank you so much for joining us.